International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
Greetings from New York University here in Washington Square in New York City. My name is Victor Rodwin. I'm a professor of health policy and management, and I'm pleased to summarize our recent editorial with my colleague Michael Gusmano of Rutgers University School of Public Health, titled Needed Global Collaboration for Comparative Research on Cities and Health. We wrote this editorial to persuade colleagues and funders that more research is desperately needed on cities and health. There are many groups advocating for healthy cities, healthy aging, and this is all to the good. However, despite studies of cities in the field of urban planning, we find very few comparative studies of cities and health. In essence, the case for more research on this theme rests on four propositions. First, as most people know, over half the population today in the world lives in cities, and UN demographers project that another 2.5 billion people will live in cities between now, or at least by 2050. Second, there are many well-known limitations to comparative research on national health systems, some of which can be addressed by focusing on cities. The most notable limitations have to do with the size of so many nation states, the differences between urban and rural areas, and the difficulties of generalizing about national systems. The third case or proposition on which our case rests for doing more research on cities and health is that cities ultimately are left with all of the healthcare problems not solved at the global, the national, or subnational level of government. Ultimately, cities are the healthcare providers of last resort, along with neighbors and families. And finally, many believe that the nation-state or nation-states in general are increasingly difficult to govern, and that cities can get things done. At the end of the day, they pick up the garbage, they provide transportation, they wrestle with inequalities, they manage pollution, and they provide health care for the most vulnerable populations. So after making this case that we do need more research on cities and health, for the reasons I've just given, we suggest that a research program on cities and health ought to address at least two conceptual and methodological issues, and then some fundamental research questions on this topic. First, it's really critical to define relevant units of analysis, the boundaries and characteristics of cities one would wish to compare. There are simply too many studies that take parts of cities or neighborhoods of cities or compare cities that are so different that in some sense it makes no difference to compare. It makes no sense to compare, rather. Second, we believe that it's essential to structure comparative analyses around similarities as well as differences among cities and their neighborhoods. Such an approach can enable some quasi-experimental designs and the generation of hypotheses on the impact of differences in public health infrastructure and health services financing and organization across cities that share a set of common characteristics. Finally, we suggest in this editorial some research questions for study. For example, to what extent do cities promote or undermine population health? What city characteristics affect the organization of their public health infrastructure and healthcare organization? Or conversely, what are the effects of hospitals, academic medical centers, medical research and training facilities, and patterns of access to primary care on the local economy of cities, as well as on their population health? How do national and subnational patterns of healthcare financing and organization affect city-level interventions in the health sector? How do spatial inequalities in the supply of health services across city neighborhoods affect a city's healthcare system and population health? Imagine, we suggest, if we could create for cities around the world the equivalent of OECD's extensive database for wealthy nations. Its healthcare database is what we're referring to. Such a global database would enable us to extend previous research beyond urban subpopulations to a global network of cities and their performance of healthcare systems, and also other interventions to improve population health and service delivery. We hope that this editorial stimulates some reaction and some possibilities of collaboration with like-minded colleagues who would like to participate in raising funds and collecting data to better understand the nature of healthcare systems and population health in cities. Thank you for your attention.